Hi, my name is Jackie Rodriguez, and I'm a senior at St. Thomas Aquinas High School in Fort Lauderdale, Florida. I am also an Ambassador Girl Scout working on my Gold Award. For my award, I am making a career video to help high school students get a little insight on some professions. Enjoy. I am pleased to introduce you to Dr. Mark Savitsky, who is a pediatrician and a graduate from the University of Florida. So, Dr. Savitsky, would you like to tell me what an average workday is here at the office?
Usually we arrive around 8 in the morning, and basically we see only patients in the office setting here. We don't really do any hospital settings. We work from 8 to 12. We see all kinds of patients, checkups, rechecks, patients that are sick, newborns, ranging anywhere from the ages of birth all the way up till 21 years of age.
Is this job what you thought it would be like, or is it different than you expected?
It's pretty much the same. I always loved pediatrics, and it's a fulfilling specialty, and it's fun to come to work.
Besides University of Florida, are there any other colleges that you know of that are good for a degree in pediatrics?
Actually, I went to medical school at the University of Florida, but I did my pediatric residency in North Shore and Long Island, and pretty much any of the accredited programs are excellent. Probably the best programs are in Boston or Philadelphia, but pretty much pediatric training, most programs are pretty good, and they train you well to be able to survive in a career in pediatrics.
About how many years does it take to complete a doctorate degree?
4 years of college, and then 4 years of medical school, and then it usually will be, depending on what residency you want to do. Pediatrics is 3-year training, but it can go all the way up to 10 years for neurosurgery.
Mm-hmm. Is it easy to find a job right out of college?
Not a problem at all.
Really?
Well, it's not really it's not like you're out of college. Remember, what happens is you have to do your medical school training, then you have to do your residency. But the thing about medicine is you'll always have a good job. There's always doctors needed wherever you go, either in the private sector or working in a hospital, working in emergency room. That's the nice thing about pediatrics, is that there's a lot of different settings. You could be an in-hospital doctor, work only with hospital patients. You can just become a general pediatrician like myself, where we work basically as an outpatient. Or you can even do a specialty in pediatric and become a specialist, where you treat patients with heart problems, patients with lung problems, people with kidney problems. So you have a lot of different variety that you can go into just from the field of pediatrics.
And if you specify in a certain pediatric, would you have to spend more years?
Yeah, depending on your specialty, specialties can range all the way from most pediatric fellowships, they're called. Once you're done with your pediatric residency, you do a fellowship. Most fellowships can be anywhere from 2 years to, if you want to do a surgical specialty, 5 years.
What's the starting salary for a...
Starting salary now for most pediatricians right out of medical school is probably, I would say, about between $100,000 and $125,000 a year.
That's good.
Good living right out of school, exactly.
Very good.
Yeah.
And how many days a week do you usually, you kind of answered this already, but how many days a week or hours a day do you work?
Actually, I work, our usual days are from 8 to 5, so we work and we break for about an hour and a half for lunch, so we have like a 7.5-hour work day. In our practice, we all work 4 weekdays. We get a weekday off, and then we pretty much work every Saturday morning, which is from 8 to 12. That's our typical day. So I would say on average, we probably work between 30 and 40 hours a week.
Is there a time where you have to take home work to finish at home, or is it all?
No, in our practice, we pretty much, when we're done, we're done. We also do night call, so that when we're not in the office, we have, I have 6 partners that are full-time with me in the practice. We share our night call, so when we leave the office, one of us is always responsible for the care of the practice after we leave. So we're available via our cell phone for emergencies, if there's any questions from patients, things like that, until the following morning. And that usually occurs basically 1 time a week that we're on call. But the rest of the time when I get home, I'm pretty much done, because we have one of us that covers the whole practice for the rest of us.
Nice.
Okay.
Is there any required continuing education?
Yeah, we do. We actually have to do a minimum of 40 hours of required education every year. Usually, most of the time, it can be done either at pediatric conferences or general, medicine conferences, or you can do a lot of online work. I do a lot of things where I keep up with a lot of the continuing medical education journals, and you have to do testing online. As a pediatrician, you have to be board certified, which is typically an exam that you have to take every 10 years, which is a written exam, just like you have to bubble. It's a 4-hour exam that you have to pass in order to continue to be board certified in pediatrics.
Okay, that's good. And Are you required to wear any special clothing or uniform at the doctor's office?
As you can see, I don't.
I was looking at that.
Yeah, you know, our pediatric practice is pretty mellow. There are certain practices that require white coats. In our practice, nobody wears a white coat because kids typically are scared of white coats. We don't usually like to wear ties because the first thing a kid does is grab the tie and they drool on it, so they get messed up. So pretty much our practice is pretty casual, as you can see.
Is there more men or women in pediatrics?
Actually, interesting enough, pediatrics is probably the only specialty where there's more females than men. Yeah, most pediatric residency programs now are 60% female and 40% male. Just because pediatrics is very rewarding, and I think a lot of women have a lot of maternal instincts, so they're good around babies and little kids. And also, in general, pediatricians tend to be pretty normal people. They're not very high-strung or high-stress people. So it's actually something that's very amenable for a female, for instance, they want to become a working mom and be able to juggle a pediatric practice and also being a mom and raising a family. It's a perfect specialty for them.
All right. And is there anything else that we didn't cover? Would you like to mention here today?
No, not really.
Good. All right. Thank you.
Thank you.
Thank you for having us here today. It was very interesting.
Okay, thank you very much for having me.